in our community. So I'm very appreciated to prepare these webinars organized by the ACAPs and the IMPIA. And I'm connecting both of the network. So especially, I'm very appreciated Susan and the Catherine. So before our sessions, I would like to welcome message from our two presidents, the ACAP and the IMPIA. And then Catherine, could you give us the welcome message for all of us?
Yes. Thank you everyone for coming, and greetings from ACAP. Welcome to this very important November ACAP webinar on an important topic of elder abuse. I just wanted to let you know, if you're not an ACAP member, ACAP stands for Active Aging Consortium Asia Pacific. We're a group of gerontologists around the world and dedicated to friendship and to sharing best practices. Our organization is free, and we have a bulletin that comes out every other month and a monthly webinar. This is one of our series of monthly webinars. I would like you to just know that if you'd like to join ACAP, we welcome you. Just send me a message in the chat with your email and I'll add you to our mailing list. And we will be having a webinar in December on a really fun topic, which I'm going to show you. If I can share my screen, just to show you our, it will be on healthy foods and a holiday party. So we invite you to come and share about any kind of healthy food in your culture. And I will be putting this registration in the chat towards the end of the session today. But for now, I would like to welcome you and say thank you so much. It's so nice to see all of my friends from around the world and to make new friends here tonight. So thank you very much, Dong-hee. Back to you.
Yeah, thank you so much. Catherine, it is, what time is it now in Hawaii?
It is 2 a.m., but I look pretty good for 2 a.m., I think.
You're looking good.
It will be the midnight. I'm very apologize for breaking the good strips. And then next, our president, the International Network for the Prevention of Elder Abuse, the Susan Sommer. So could you do our warm welcome message for all of us?
Well, thank you very, very much, Dong-hee and Catherine, and Dong-hee, all the work you did to bring this session together. It is so essential that we discuss the issues surrounding elder abuse, this last taboo, and which largely affects older women around the world. And IMPEA, as you know, having been one of the founders, Dong-hee, or not only is one of the founders of IMPEA, but also started the very first program awareness network in Korea, the KINPI, and we're very much in debt to her. And I'm so pleased to see so many of our members here from Asia Pacific region. I should just quickly mention that we have the chair of the Committee on Aging in New York here with us, Cynthia Stewin, who was gracious and distributed our information about this important meeting. So we do all work together, as Catherine said, as friends and colleagues for this very important issue. It's very disturbing to think that after 25 years of IMPEA working in this area of raising awareness on elder abuse, that we still have pretty much a rampant situation. We haven't moved very much forward since the United Nations Principles of Older Persons that was adopted in 1991. And as the global population grows older, the abuse of older people, most of them women, as I said, needs to be addressed first by governments, advocates. It's not about palliative welfare, but about ensuring basic human rights, as was said in an article by Barbara Cosette in Pass Blue, which is a news article letter that goes out for people who are retired or beyond the blue of the United Nations. I know that our member, Marie Bellew, will be telling you many statistics and information about the World Health Organization's work and her very important work. So I'll jump over those. But I did want to mention that this COVID situation has brought out the best and the worst of us, and the worst of the situations with regards to treatment of older persons, particularly older women. And for the very first time, the United Nations Secretary General had issued a brief on a policy brief on the rights of older persons. And that information that he put out was supported by 146 member states around the globe. However, although he called it as it is, the human rights of older persons are being trampled upon. And as we only have non-binding documents, soft law, we don't have a binding core human rights instrument. The discrimination against older persons is allowed to continue. We do have to work together to get binding human rights legislation, a new convention on the human rights of older persons. And all of us should be guided by a commitment to respect the right to health and the right to life and dignity of older persons. So with that, I'm going to close and perhaps come back and talk to you about the open-ended working group issues at the end of the program. Thank you all very much for being here and being interested in this issue. And we need to all work together. So Impea welcomes you all. So thank you.
Thank you, Susan. Today, we invited the 5 speakers from the Quebec and the Brazil and the Hong Kong and the India and the Japan. So the all are very important persons working elder abuse for 20 years and more than 30 years. So I would like to introduce the first the Mary Pierlier, and then just can you raise a hand? And the Tadashi Wada in Japan, and also the LCA in Hong Kong. The Marla will join the not yet. Okay, so we will have the sessions, and then the end of the sessions, we will have the Q&A sessions. So if you have any question about the whole things in elder abuse issues, please use the chatting, the memorize, and then we will gathering the end of the sessions. We discuss times after whole speaker talk. So I would like to invite the first speaker, the Mary Pierlier, and from Quebec, Canada. She is the professor at the School of Social Work, the University of Sherbrooke, and a researcher at the Research Center on Aging, the Public Health and the Social Services of Eastern Townships region in Quebec, Canada. She is also the fellow of the Royal Society in Canada since 2010. And also she is working with especially the WHO, and a research center on aging specialist, the age-friendly city community, and countering mistreatment. Today, she will talk about looking at the elder abuse as a global priority, global, regional, and the national priority. So I want to switch the Mary.
Well, dear colleagues from ACAP and PIA, and also dear Dong Hee Han, thank you very much for having me this morning on board. Well, I say morning because for me it's 7:15, but I know it's afternoon or evening or even middle of the night for many people all around the world. That's the joys of working together. It's a pleasure to be with you, and I'm going to start sharing my screen. I hope you see it. If not, just tell me. If I hear nothing, I'm thinking that you see everything. So like Dong-hee said, I will be talking about elder abuse as a global priority. And when we're talking about global priority, I want to tell you that I will also raise at some time certain regional or national priorities. This work has been done during the past almost 2 years. We're a group. I'm working with Christopher Micton and Wang Ji Yan from WHO. Laura Campotena is a PhD student in Cambridge, but she's also doing some contracts with WHO. And Yushra Shavar is from the Johns Hopkins University in Washington, and she's a specialist of global political priorities. So, oh, just a second, doesn't seem that the slides are moving, so that's not a good sign. I'm pressing the arrows. Okay, it moved. Sorry about that. So let's see elder abuse as a global priority. WHO has been conducting 2 meta-analyses. So that's actually looking back at a series of rigorous studies all around the world to try to compare them and find the figures. What they found is during the past 12 months or during the past year, for older persons living at home, 1 out of 6 did experience elder abuse, which is a lot. Also, when they try to have a prevalence for elder abuse in nursing homes or any other resident communities, what we found is that we don't have a lot of data coming from the older person themselves. So we have to look at staff, and 3 out of 5 staff members reported being abusive towards older adults, which was very much actually. We know that elder abuse has serious consequences, such as physical health, mental health, social health, financial consequences, and in certain cases, it can lead to death. So people are more sick than the others, and we know that they can have premature death. Sorry, okay. So our project was aiming to identify the factors shaping the global political prioritization of elder abuse all around the world. What is a global priority? Well, a global priority is the degree to which international and national political leaders actively give attention to an issue and back up that attention with the provision of financial, technical, and human resources that are commensurate with the severity of the issue. We use a framework that was developed by Shifton and Smith in 2007. And this framework is really looking at the issue from 4 different priorities. So what is the action power? What are the ideas? What is the political context? Also, what is the issues of the characteristics? So regarding action power, we really want to see the strength of the individuals and organization concerns with the issue. And the ideas, we want to see the way in which those involved with the issue understand or portray it. So in this case is how do we see elder abuse all around the world? The political context is really looking at the global environment in which the actors can operate. So we have to look at political windows, but also global government structure. And I want to tell you that the COVID was a very important political context because it was really there as an eye opener regarding elder abuse. And finally, we have to look at the feature of the problem. And we want to see if we have credible indicators to talk about elder abuse, its severity, and also, and that's a big question, what is the effectiveness of the interventions? So we decided to prepare a paper that has 3 blocks. So the nature of the issue, policy environment, and the capabilities of the proponents, and I will be addressing those 3 blocks. But first of all, let me give you just a little bit of background regarding the method. So we did a desk review, so that's a literature review of both academic and gray literature all around the world. We looked at the past 21 years, and we found many papers, as you can see, 27,000 more papers, but actually only 123 were really addressing the issues that we were looking at. We also did a series of interviews with key informants. And 80% of the person we did interview were elder abuse experts, leaders, or advocates, but also we had 20% of informed onlookers. What are informed onlookers? It is persons that are close to the field, but not really in the field, that have something to say about it. So we were really trying to have the most diverse sample as possible. So international government organization, international non-government organization, international non-government organization, and academia. And you see that we have 9 of those. So it's kind of the majority of our sample. And that's people like me, like Donghi and others that are here this morning that are both in academia, but are close to the field. So we have also people only in academia and some people in government organization. We did our best to have a series of people from all the region of the world. However, it was more difficult in certain regions than in others. So we have more people coming from the American and the also the European. And like I said earlier, our analysis was based on 3 major themes: the nature of the issue, policy environments, and also the capabilities of the proponent. So let's look at the nature of the issue. Well, the analysis really revealed that there are some issues when we want to go straight forward on elder abuse, and some characteristics of elder abuse complicate the efforts to increase its priority. Actually, the first question is, how do we frame elder abuse? And some people are talking about the importance of pushing forward the autonomy, while others are talking about the safeguarding. And in certain cases, the two are presented as a balance, but in certain cases, it's kind of a tension. And we can see that the people who were more involved in violence against women, domestic violence in that field, will push more for empowerment and autonomy. And people who are maybe more influenced by child abuse will talk more about protection. Regarding the cultures, well, it was very interesting to have respondents from all around the world, because we could see that the culture is really important when framing the issue. And when I'm thinking about Asia Pacific, we heard things like the importance of a family approach to the problem, but also the importance of using the good words. And I'll come back later on this. But it was clearly said that elder abuse is a too harsh term to be used that way. So a lot of times we will go more with neglect or other terms. We heard a lot about ageism, stigma, and shame. And here you have a series of quotes from our interview. And one person said, older people are devaluated and viewed as expendable. It was also said that there's a lot of confusion because discrimination is an important topic. Ageism is an important topic. But if we lumped everything together and call that elder abuse, we can end up diluting the focus. So at the present stage, I feel it's best we focus on what is traditionally considered as elder abuse. So you see, people are kind of saying that ageism is attached to elder abuse, but ageism per se is not really elder abuse. However, in time of COVID, a lot of countries said that we saw a lot of ageism. There was also a lack of awareness and doubts about the prevalence estimates. So I've showed you the prevalence from the WHO on my first slide. However, we know that there's no golden standard to measure elder abuse. So that will complicate the comparison between the results from one study to the other. So we could call that a current intractability of elder abuse, because each study will use its own measures. Regarding policy environments, we know now that we have a certain numbers of political windows, and 4 important political windows were identified. 3 are on this slide. First of all, we can work with the sustainable development goals and try to see what applies to older person. Certainly, one of the important things in our field is the World Elder Abuse Awareness Day that is there every June 15. And also, we have to get into that UN decade of LT aging that just started, because through the 4 major themes of this decade that are ageism, long-term care services, age-friendly community, and coordination of care and services, there's a lot of possibility of addressing elder abuse and neglect. The 4th theme in this policy environment, and this is the theme of the day of this session, is the COVID-19 pandemic. And here are 2 quotes that certainly raise a lot of issue around elder abuse, particularly in long-term care. It really highlighted the issue in the long-term care sector, whether it's around staffing shortage, whether it's around built environment. The abuse of seniors could have been prevented in many ways if we had an up-to-date regulatory regime with long-term care. And I put in red here a quote that was coming from someone from Asia, actually, and saying that older persons were not receiving a lot of attention. So they were in queues, long queues to obtain masks. So we have to raise a common understanding of elder abuse and neglect. And here is another quote that comes from Asia Pacific. And it says, you know, in India, in the Asian context, the word elder abuse sounds very strong. So people in general and the government don't like to use it. What they do prefer is either mistreatment or neglect, or even isolation or abandonment, because that is quite common in the South Asian countries, at least, where older people are abandoned in certain circumstances. And so that is kind of recognized. But abuse for them sounds very harsh and a strong word, which involves a lot of violence, which involves a lot of discomfort to the elderly, and that goes kind of against their concept of family unity and respect for older people and so forth. So all that to say that we need to have more synergy between human rights and also public health framing. And thank you to Susan Summer to raising it, because it's not in opposition. Actually, we have to work together, and a good public health framing will include human rights. When we ask the people who were the global network and organizations or the individuals that were doing a leadership in this field, certainly everyone talked about the International Network for Prevention of Elder Abuse, but they also talked about other agencies that sometimes were there, sometimes less there in raising the issue of elder abuse, because it's not their only topic, such as WHO, LPAGE International, and other agencies. And certainly we have to continue to build coalition. And I think that's what we're doing this morning, well, today. So in conclusion, we have a series of opportunities to put elder abuse in the global political agenda. Like I said, we can use the UN decade for healthy aging. It's now time to have a stronger partnership of the UN and the other agencies. And certainly the first agency to partner with is always the NPA. We also want to be there in the global campaign that the WHO just started to combat ageism. And we know that overcoming the challenges to increase global priority of elder abuse will require concern and sustained efforts. So we need the establishment of a global network to develop, evaluate, and scale up package of effective and cost-effective intervention. Because when we look at intervention on our field, we don't have a lot of data, good quality of what has been measured about what works and what doesn't work. So we know that this study has limitation. Like I said, we don't have people from all the regions of the world, and we were very sorry about that, even if we tried. And we have more difficulties of finding respondents in low and middle income countries. So we have more respondents from high income countries. I want to tell you that we wrote a paper out of this important work, and this paper is now under evaluation in a journal. So I'm just saying, stay tuned for this paper that will be called Understanding the Factors Shaping the Global Political Priority of Addressing Elder Abuse and Neglect. And thank you very much. So being from a French background, I'm saying merci beaucoup. And it will be a pleasure to go into the conversation now.
Okay, thank you very much, Mary. And that it is very meaningful research in COVID situations. The political reality is very important. So you have done that. And also the end of the sessions, we will have the question about your presentations. Okay, thank you. Okay, second speaker, and I would like to invite the Professor Ran. Erxian. She is the professor in the Department of Applied Social Science, the Hong Kong Polytech University. And her research interesting include elder abuse, dementia, and the family caregiver, and the intergenerational relationship, and also the elder sexualities. The Yan had done a lot of research for a long time, and then this time the C is started 2019 till in a COVID situations. C research about the panel study. Okay, the Professor Yan, could you switch your presentations?
Right. Could you see my screen share?
Yeah.
Okay, thank you. Thank you, Dong-hee and Catherine again for having me, and thank you, Marie, for such excellent presentation. So I'll keep this short. So this is work done in collaboration with Professor Daniel Lai. So what we did was we look at how COVID-19 shaped abuse and discrimination of older persons in Hong Kong using a community representative panel study. Okay, so the way we see it is that COVID-19, it highlights lots of the known risk factors associated with elder mistreatment or elder abuse. And then it also creates new opportunities or new avenues for mistreatment. And then there has been, apart from elder abuse, as Marie has pointed out, we have older persons have been discriminated against, and they were in a very disadvantaged position in the community, which we have overlooked for a very long time. And so for this study, what we did was we conducted population representative telephone survey of older persons who are residing in a community. It is pretty easy to conduct in Hong Kong because we have very complete list of telephone numbers, residential address of households in Hong Kong. So we did our first wave study back in November 2019. That's at the beginning of the outbreak. And then at the middle of the pandemic, December 2020 to January 2021. And it's important to note that those were like separate samples. So at both times we used the identical sampling procedures, but then so both samples were representative, but then we actually interviewed different people over the phone. And then we collected information on the respondents' demographic characteristics, their relationship with family members, physical and mental health, any experience of discrimination and abuse they experienced during the time of the interview. So let's look at the rates of discrimination and abuse. First wave, that is like at the beginning of the outbreak. So about 9% were treated unfairly, and close to 20% will consider themselves disrespected, and close to 17% were refused services because of their age. And for abuse, the most prominent and most prevalent ones were psychological aggression, followed by physical abuse and financial abuse. And if we look at the second wave, it looks as though rates of discrimination increased a lot. It's actually doubled, but it was not exactly statistical significant change. So apparently, it looks there's an increasing trend for people feel that they were treated unfairly or disrespected, and a slightly lower rate of refused services. We suspect that is because people has very limited chance of going out at all, so they don't have lots of opportunity to receive services to begin with. And then as for rate of physical, psychological, and financial aggression, they were pretty similar to what we observed in the first wave. So we conducted a series of regression analysis looking at how various factors associated with participants' physical health. So apparently, let me put it this way. So apparently, financial health is a very prominent factor, and so is loneliness and abuse and discrimination. And it is noteworthy that after we enter loneliness into the model, the effect of discrimination and abuse sort of diminished. So we suspect that there is a mediation effect that abuse and discrimination affect physical health via loneliness. And so we did additional analysis to look at that mediation. So apparently, I've looked at elder abuse and age discrimination separately. Both models were significant. So loneliness did mediate the association between elder abuse and age discrimination and physical health. And very similar patterns were observed for mental health. So what we see is that abuse and discrimination, they were associated with participants' mental health, that they would negatively impact participants' mental health. But as we enter loneliness into the model, their effects somewhat diminished. And then financial health appears to be a protective factor for participants' mental and physical health. And then again, if we look at the mediation analysis, the Sobel test, so the mediating effect of loneliness is significant for mental health. And so in summary, what we observe is that discrimination and abuse, they were very common. And then the rates were kind of stable throughout the pandemic. And obviously, abuse and discrimination both negatively impact older persons' physical and mental health. And these associations apparently were mediated by sense of loneliness. So it's very important that we provide older persons in the community with ample social support and supportive network. And on a separate note, good financial health appears to be a protective factor for older persons' physical and mental health. So financial security is also important. And COVID has been terrible for everyone, but we feel that it provides an opportunity for us to reconsider how we have been treating older persons, senior citizens in our community. And it is time we give the voices back to them, and so rethink what we could do to help them live a fulfilling and healthy life. So that's the end of my presentation. Thank you very much.
Dong Hee, we don't hear you.
You're muted, Dong Hee.
You're on mute. Yeah.
Okay, thank you. So thank you, Professor Yan. In Korea, also the COVID pandemic situations, the elder abuse, the cases in equalized, especially the in family and at home. The cases is equalized. So you are the very good research about the panel research community representations in Hong Kong. Very appreciated sharing your research. Okay, and then the next, I would like to invite Else Miselis from the Belgium. She published a lot of books about the elder abuse, and especially she is very interested in 4 topics: elder abuse and the retirement planning and the storytelling and the sexuality, intimacy, and the skin hunger in all the ages. She is a member of ACAP and also the Pioneer and the Belgium Society for the Gerontology and the Geriatrics. Else, please.
Okay, thank you, Dongi. Thank you so much for having me in. Also, thank you to Mary and Elsie for their wonderful presentation. And I will try to share my screen. And I hope it will fit now. Yeah, can you see my screen? Can you see my presentation?
Not yet. Okay.
And I will start with the first one. Yeah, is it okay like that? Wonderful. Thank you so much, everybody, for being around. I would like, as a ACAP member, would like to give my presentation the importance of a scientific, but also a people-oriented approach to elder abuse. So I think that the importance to highlight the scientific insights concerning early diagnosis, risk and protective factors associated with elder abuse are very, very important. And from my perspective, I always work with the framework of Bronfenbrenner, who is looking towards individual relationships, community, and the whole society. And I would like to come back to our European project, where I was a member from Belgium, the Breaking the Taboo 2 project, who falls under the so-called universal interventions, which raise awareness about elder abuse among caregivers and social professionals, and which set up trainings for various professionals. It's nearly 10 years old, but the Breaking the Taboo project 2 in Belgium is still going on, and we are still raising awareness on that topic, giving training sessions based on the Breaking the Taboo 2 project. But there was no COVID-19 in that in that time. So society have changed, many things have changed. And I think the iceberg theory is still very important. What do we see outside and what is under the surface? There was a lot of going on. And when we are looking at the definition of elder abuse, well, Mary said that we all are framing the issue, and maybe we can stick to the traditional definition. If I look in Flanders, the part of my country when I'm active, well, we also have the explicit distinction in, on the one hand, the criminal forms of elder abuse, but we are also working on what we called the derailed care, the more supple, less spectacular forms, just such as infantilization, restriction of liberty, no privacy on the toilet. And I think when we are framing the topic, I really would like to discuss if the derailed care, the subtle, less spectacular forms can be also taken into account in our discussions. For instance, in COVID-19, we really have got problems with elder rights. So this is very important as well, I think. So we really have to come to a discussion which is not only seen from a political view, which is really, really important, but I think we have to raise also the discussion on the more ethical, philosophical and cultural debate. If we see that so many people are involved in elderly abuse, in trusting relationships, if we see so many based care workers and family who are moving in the gray area of elderly abuse, we see in our country this is a really very important topic as well. And if we look at the forms of elder abuse, which is also described by the World Health Organization, that we see the physical, psychological, emotional, sexual, financial or economic abuse. Well, in Belgium, we consider neglect and violation of the rights also as a very important issue. And maybe I would like to raise this discussion, but all the problems with the skin hunger, the state of being touch-starved, I think, and I consider skin hunger now also as a form of maltreatment, because we have the link with COVID-19 that so many weak people, so many single people have not been touched in a way that it was okay. So many life stories come up on this issue. I have just published with my colleague, Jan van Veldhoven, also a gerontologist, the book on coloring outside the lines. We outline 15 recommendations for implementing what we call warm care, because we see a lot of elder abuse, and we have especially raised many stories on sexual abuse. And in long-term care facilities, we have received many stories on unacceptable behavior, from a sexual intimacy point of view. And we try to work on the issues of warm care. For people who want to have more information on that, we have published an article in one of the newsletters of ACAP. So it's really about unequal relationships. I think that most of the people are good people who do bad things. And it's also a matter of civilization. And we have received in COVID-19 so many stories about narratives who takes distance between the people. But maybe we can also look towards narratives that connect. If we listen to the silent voices in times of COVID-19, I have presented some of 20 life stories in my new book, Touch in Times of Skin Hunger. It is published in Dutch. And I want to share, to end my presentation with 3 stories. This is the story of a 57-year-old nurse who has been giving care massages towards people with cancer for many years. She was used to use a mask a face shield and special clothes, even before COVID-19. And she told me touching stories about her patients, people who were not touched by their partner since the diagnosis of cancer. So this was really, really touching. Another story is about, she was not anonymous. She wanted to be here and tell her story with her name. Marie-Louise is a 70-year-old widow. Her husband passed away last year in the COVID-19 period of time. But she was allowed by the long-term care facility to enter his room, to cuddle her husband, to give him care massages and relaxation baths. Although they struggled with their sexual intimacy because of his illness, they could be intimate in an emotional way. And I take her with me now to my lectures, because she is also referring to other stories that people are abused, and she has known the love of her husband, although he had severe dementia. And by raising her story, by telling her story, older people, they want to open their hearts as well, even on elder abuse. So we're making small steps, but very important steps, I think. And then the last story is, I cannot share all the 20 stories with you, but this is the story of a young occupational therapist who gave her residents in COVID-19 times with dementia a doll in their hands, or maybe an electronic cat. She was dreaming about using a cuddle curtain and want to install it anyway. And one of her residents is, due to dementia, very anxious and restless in times of COVID-19. And she calms down when she feels the head of the occupational therapist with her forehead. So I think in conclusion, if really human touch is not possible in times of COVID-19, we can look for non-technological and technological aids that can be used in times of COVID-19. It's a real new research that skin hunger is linked with elder abuse, with maltreatment. But I think this is really a topic that we have to raise and take into account if we speak about elder abuse and maltreatment. I would like to thank you for listening and your participation. And I'm very much looking forward to comments and questions. Thank you so much.
Okay, thank you, Els. And she's talking about the universal, the interventions, especially the skin hungers. And in COVID situations, we talk about the loneliness and the mental health, and also the emotional expression, something. So she is very special talking about the universal interventions. So we Mary emphasized the traditional interventions, elder abuse. So also we needed this kind of many programs, universal interventions. Thank you, Els. And then next speaker, I would like to invite the Dr. Tadashi Wada. And he was the president of JAPIA and also leader of the elder abuse in Japan. And then he is the primary care physicians and the home medical care specialist, and also specialist of the elder protection services against abuse, neglect, and exploitations, aggressive taking care of the COVID-19, the patients in outpatient and the home care setting. And also he is the education's young physician and the community social workers. And then Tadashi Wada, please. Can you hear? Okay.
I cannot hear the presentation, Dong-hee.
Can you hear me?
Yes, now we can.
Okay, thank you.
Thank you.
Sorry. It is my great pleasure and honor to be here and talk to be able to talk with professionals around the world. At first, I was planning to talk about the issue of elder abuse prevention law of Japan. However, this event is for the elder abuse in COVID-19 pandemic. So in first 5 minutes, I'd like to talk about our efforts against elder abuse in this pandemic. Then in next 5 minutes, I'd like to talk about the issue of elder abuse prevention law in Japan. I am currently serving as the chairman of the Protective Service Agency of Matsudo City Government, Chiba, Japan. Matsudo City, Chiba Prefecture is neighboring to metropolitan Tokyo, population 500,000, older population 25.5%. You can see the Mount Fuji from our city. This is the number of reported cases of our agency concerning elder abuse in domestic settings. Sorry, this is the source of reports during 2011 to 2020 on elder abuse and neglect and exploitation cases in home care setting, domestic settings. You can see the increase of number of reported cases was observed in 2020 compared with 2019. However, this increase was probably due to enhanced police activity, not due to the influence of the pandemic. I'm sorry, my PowerPoint is not working. Sorry. you can see the activity of police reinforced law enforcement activity is gradually increasing in these several years. Uh, I would like to talk about assistance to get the 100,000 payment of Japanese government coronavirus financial aid programs. In April last year, central government announced they will pay 100,000 yen to everyone as one of the emergency economic package. All residents of Japan were eligible for this benefit from the government. Beneficiary was the head of a household, and the head should make an application for the entire family member and receive the sum of the payment at once and should deliver to the family members. However, in financial abuse or neglect cases, a head of the household was a perpetrator. It was high possibility the perpetrator would not give the money to the victim. So, our Elder Protective Service Agency encourage social workers, including care managers. Care managers are managers for long-term care insurance system to assist victim to get the money. In some cases, social workers assist to divide, break down the household, change the address of the victim, and enable the victim to get the payment. And I will talk about the assistance to get the vaccination. In elder abuse or neglected cases, victims sometimes cannot get vaccination because perpetrators frequently reluctant to assist them to get it. Elder Protective Service Agency of our city encourage social workers to assist victims to get vaccination. Social workers assist them to get the reservation of the vaccination and often accompany them to the vaccination sites. Matsudo City Medical Association is helping these social workers and the victims by carrying out vaccination at their home if necessary. Next, I would like to talk about detection of elder abuse in Japan, not covered by the elder abuse prevention law. According to the elder abuse prevention law, elder abuse is defined as those inflicted by caregivers. Therefore, there is a big problem. Abuses by non-caregivers are excluded from the coverage of the law. We are investigating abuses by non-caregivers to clarify the proportion of excluded cases among those reported to the Elder Protective Service Agency. In assessing the effects of definition of elder abuse of our law, we employ WHO definition to compare with it. WHO definition of elder abuse is very comprehensive concept, including abuses by both caregivers and by non-caregivers. WHO definition is that elder abuse is single or repeated act or lack of appropriate action occurring within any relationship where there is an expectation of trust which causes harm or distress to an older person. This type of violence constitutes a violation of human rights and includes physical, sexual, psychological, and emotional abuse, financial and material abuse, abandonment, neglect, and serious loss of dignity and respect. In 2018 to 2019, our agency received 525 reports of cases, and we investigated 497 eligible cases. In 497 cases, 299 were confirmed as elder abuse by the law, and 198 cases were excluded. In 497 cases, 475 were WHO elder abuse cases. Therefore, 176 elder abuse cases by non-caregivers were excluded from the coverage of the law. You can see the substantial portion of elder abuse cases are excluded from the coverage of the law. We consider the definition of elder abuse of the law should be corrected in order to give appropriate protection for abuse cases by non-caregivers. Conclusion. Increase of the number of reported elder abuse cases was observed in last year compared with the year before. However, this increase was not interpreted as an influence of the pandemic. Social workers in our city are making efforts to help elder abuse victims in getting the 100,000 government payment and in getting vaccination. We consider the definition of elder abuse of the law should be corrected in order to give appropriate protection for abuse cases by non-caregivers. Thank you for your attention. Very sorry for my PowerPoints was not working. Sorry.
No problem. And then appreciated Dr. Tadashi Wada. And every country the encourage the elder abuse cases in COVID situations. Especially he mentioned about the detection of elder abuse not covered by elder abuse prevention law. It is very meaningful, the presentations for us. Okay, the last presentations, Mala. Mala?
Yes, sir.
Okay.
Yeah.
Okay. And everybody knows the Malas, and I would like to introduce. She is very internationally famous in the very good publish. And also she was just retired in the university in Delhi in this year. She has published many articles and is the author of the 10 books of different aging issue with 3 on elder abuse and 1 on the impact of a pandemic. And the C consultant with the United Nations Agency is the resources person with the various Ministry of Government of India. She is also the representative of the Asia Impia. Okay, Mala, please.
Yes, thank you very much, Donnie. And I also would like to extend my thanks to Catherine and Susan for making me part of this important webinar. I congratulate ACAP and IMPIA for organizing this. I'm happy to share my thoughts today. And I start with few introductory comments because I'm going to talk of elder abuse and the pandemic, assessing the situation and the responses, while I'll focus on India, but it also has reference to Asian countries. So as my research indicates, and here I would just like to share some of my research over the last 2 years. Outbreak of coronavirus is particularly harmful and damaging for elderly in terms of social, economic, and emotional dimensions, more so as they are a vulnerable section of the society. Based on various surveys, we can say that there has been a massive increase in reports of elder abuse during the pandemic situation in many countries, including India. And as more research findings are coming in, it shows the criticality of the issues. Abuse is being done by family members, care service providers, by community workers, and in general by all sections of the society, including by the government because of certain insensitive policies to address the urgent and emerging needs of older people, and in a developing country like India, and also in some of the neighboring countries, we see a huge resource crunch with the state to address the concerns of older people. Though, as I will point out later, some steps are now being taken based on increased awareness, prompting by UN agencies, and seeing other countries responding to the concern. I see that my PPT, which I had sent, is not being shown. Is that being shown?
Oh, no, Mala, I didn't know you wanted me to show it, but I can find it now.
Okay, sorry. I thought that is what I was my understanding to send it earlier. I sent it 2 days back, but doesn't matter. I'm just going to be speaking. So since beginning 2020, it has been a challenge for many stakeholders. The pitfalls of social distancing are visible, and glad now since last few months emphasis is on physical distancing, but not on social distancing. Because of earlier guidelines by governments, medical experts on social distancing, older people faced social isolation, which is one of the greatest risk factors for elder abuse. They were not allowed to mix with other people, go out, were totally homebound, facing hardships of difficult family relationships, and experiencing many stresses and strains. Besides vulnerabilities of older adults to the pandemic, the caregivers are also at a risk of abuse, as many of them are aging themselves, and they are overburdened and facing the brunt of older persons who's older than them, frustrations and non-adjustments with the situation. In fact, governments and those working on aging issues are unsure on how to react and meet the needs of older people, their caretakers. There is also criticality of public policy measures being enacted for COVID-19, such as closing of workplaces, markets, services, etc. There are stories of older people in urgent need of health services, not able to go to hospitals or clinics, and as a result, ignoring their health. On top of this, there is difficulty in detecting elder abuse, as surveillance is the lowest during this time, resulting in many issues related to combating elder abuse not being addressed. Reporting mechanisms are kind of not working. Many community workers had difficulty in reaching out to older people. In spite of various limitations, research has been conducted on elder abuse and the pandemic. And we find that there are various small-scale studies which reveal, you can show number 4 slide, please. Research is indicating increased difficulties in caregiving and care receiving for older people, making them vulnerable to abuse. There is increased violence against them. Various NGO surveys and helplines point towards neglect and financial problems being faced by older people. Helplines are remaining overactive with complaints, seeking advice, wanting help from by older people. In the last few months, media reports on abuse have also appeared. Stories of anguish, difficulties are being shared. And at the community level, voices of older people are revealing much abuse, their isolation, their deprivations, etc. Among older people, older women, due to higher levels of illiteracy, non-compatibility with available resources, are more at risk of abuse. And also as caretakers of children, they are more pressured in times. Voices of law enforcement agencies, community workers, also indicating incidences and prevalence of abuse, phone calls from victims, but not much is being done to help because of various other restrictions set in by the pandemic rules. Slide number 5. So major risk factors seen in terms of plummeting of money resources is there. Financial instability is witnessed by many. There's loss of jobs, of self, family members. Older people are not able to get rents on their properties because many people have gone home and houses are lying vacant. They've gone back to their villages or to their own small towns. There has been universal rise in costs of goods and services. Purchasing power has reduced considerably. Vegetables, food products become expensive, and household economy is in a mess, with the brunt of it falling on older people. I know of certain families where certain expenses are being met of children, of adults, but expenses of older people are being overlooked. Many feel health and social care is out of reach for them, and they experience difficulty in accessing cash-governed products and cannot cope with internet shopping or banking as the knowledge of such devices and means is limited. They also feel technologies and devices are costly. Many cannot afford their own computers, smartphones, etc. So they feel the limitation of these technologies. Slide number 6, please. A major factor contributing to abuse is deterioration in health. With inactivity during the pandemic, physical health has become a matter of concern. Walks of people have stopped. Exercise regime has become limited due to pressures to manage household affairs, etc. Mental health of many is affected due to depression, abuse at various levels and in different forms. And as many older people state, their emotional health is low. Communications are limited with family members and outsiders. They feel lonely, devoid of company. Also, nutritional deficiencies have set in due to non-availability and inaccessibility of many food items. Some they are not able to buy and some just not available. Researchers are seeing increased dependence on drugs, substance abuse, alcohol, and there is increased stress on older people as caregivers and children. For a long time, there is limited societal response to the pandemic for older people, and only recently there is improvement as governments realizing the need to address their concerns, and NGOs involved with aging issues are putting things and action together. And this is an encouraging sign. So I feel now when the governments are kind of a little more relaxed with the pandemic situation, and also various services are opening up, various NGOs are using, providing more services, things will improve. However, COVID-related types of elder abuse are seen as what were otherwise seen in society, but the intensity of them has increased. Physical violence has increased by spouse and also by children because of the stresses and strains which they are experiencing. Emotionally, many feel their personal needs of connecting with others is not possible because children cannot visit them, they cannot go out. Many of them are saying who have children abroad that for last 2 years, their children have not been able to come, or those who used to visit their children on annual basis abroad are not able to go. So all this is keep taking a toll on their emotional health. Financially, they feel their incomes have come down, sources of income generation have become limited, and they generally find that their spending power is reduced. There is neglect in terms of providing personal care by family members because it has been reduced by everybody being more pressured during pandemic time. I mean, children are at home, so the sandwich generation, the caretakers are finding that they have to spend more time with the children who are not going to school, who are not going to colleges, and are neglecting giving care to older people. Also, self-neglect of older people, we are finding, has become an acute problem. A lot of older people are adopting a resigned attitude, although, yes, I must say that some older people are adopting also, or rather overcoming negativity by adopting a positive attitude and encouraging their fellow senior citizens to also look at things little more brightly. So there is a mixed reaction to COVID-19. However, societal neglect has increased because, as mentioned earlier, governments, NGOs, civil society members are unable to reach to older people because of various constraints, be it travel related, be it in terms of closeness, which might be required to provide services, which is not happening now, and so forth. So in general, what we are finding is that there is violation of human rights at many levels. And I think we need to, all of us, kind of look at certain special guidelines on how to overcome this. So the good news is that certain responses to address elder abuse have emerged. There is global mitigating practices started by WHO and other UN agencies, which are playing a proactive role. They are encouraging individual governments to take concrete steps to address needs of older people, both in terms of health and social care. Various national organizations have emerged with regard to improved health facilities, services, social protection measures like giving food rations, certain monetary benefits, etc., have been initiated by the state and the central government. And both the state and central government have started now focusing on the needs of older people, trying to undermine the migratory effects, trying to undermine the impact of close down of offices, services, etc. And they are encouraging telemedicine to overcome the physical availability, going to hospitals. And they're starting computer literacy at community level, providing guidance on internet banking, shopping, etc. So we see local level strategies being adopted. NGOs, senior citizens, associations are playing a productive role. Many senior citizens who kind of play a leadership role are taking upon themselves to regularly call up fellow senior citizens who are feeling lonely or need help with certain purchases, be it in terms of visits to doctors or certain shops or for pension collection, etc. So in some ways, they are trying to reduce the incidences of elder abuse. So briefly, my few suggestions on how to avoid and prevent elder abuse in our country during the pandemic time is for older people to stay connected through phone calls, emails, Zoom meetings, or any communication that works, to remove their isolation. While physical distancing is important, but there can be various ways to remain connected. So they must reach out for help in case of any physical abuse or violent activity happening. Helplines have come up, and many are available on 24/7 basis. And neighbors and other relatives can be reached out in case of any needs. And the older people must adopt this kind of attitude to become a little more communicative. So they must address elder abuse concerns, should not shy away from them. They should not indulge in sex.
Mala, I think you're on mute. Can you unmute, please?
And they should think about overcoming financial hardships and invest wisely. So making use of technologies is becoming the need of the hour, be it in terms of health or social matters. And also various coping strategies should be adopted. They should be open to learn, open to communicate, and reach for relief, besides making oneself self-reliant and independent. So my concluding comments are that more research is required to understand various dimensions of the problem. And I'm happy to share that one of my books is already out in the market, which relates to COVID and older people. And another one, which is taking experiences of various countries as well as different aspects seen in Indian society, will be out early 2022. It's a kind of comparative thing between and it has 30 chapters which deal with different aspects of COVID and old. So there should be a combination of governmental, non-governmental, community, media, and individual effort to combat elder abuse in the pandemic times and beyond, because we cannot stop here. We have to have programs which continue. So disaster management steps are necessary at individual, community, and government levels. National goal should be to give older people an abuse-free life. So with that, I end my presentation and thank you for your patient listening.
Thank you very much, Marla. So, you already the conclusions, how can the intervention and the preventions, everything. Thank you very much. And also you are emphasized the difficulty in the detections elder abuse. It is the same situations all over the world. I am very appreciated whole speakers to fit the times. I was very nervous how can control the time schedule. So we have just 3 minutes, but I would like to the discussion times. So could you show your pace, and then 1 or 2 questions we have, and then every speaker the conclusions. The conclusion about these sessions. Do you have any question or comment for this program, and then or your country situation about the elder abuse?
So Dong-hee, I'm looking at the chat and everything is very positive. Everyone is thanking you for your hard work.
Yes, and the Kaisen, is there any questions about? There is no question.
No questions. Just say
Okay.
that I appreciate and that's very interesting.
Okay.
Can I
And
ask question?
yeah, please.
Yeah. So thank you. I'm Sailesh Mishra from India. I have one question regarding COVID. Of course, people are now realizing government is doing a lot of things, but I am afraid and experiencing non-COVID elders, seniors. They have a lot of problems still. So COVID, of course, we will tackle, but non-COVID illness, emotional, mental problems, people are still not. Government and agencies are still not able to tackle it. So how to help?
Okay. Could you answer our speakers? And then
Dong-hee, did you want the panelists to answer the speaker's question? Shall we just ask the panelists if they have anything?
yeah,
regarding
each of the country the answer the
Yeah.
Sharish question.
Salish, could you just repeat that question because maybe it wasn't clear on the
Yes.
internet?
Yes. My question is, what happens to non-COVID problem issues, especially health, mental and physical health? It is still neglected. Seniors are still not able to access the health issues of non-COVID. So I think still we are struggling to come out of COVID, and non-COVID situation still has a big problem. Seniors are not able to access physical and mental health solutions.
Dr.
Can I answer that,
Wada?
Susan? Can I answer that, Susan?
I was going to ask Dr. Wada, since he's a medical doctor, what's going on with those non-COVID medical issues, if he could address that. Dr. Wada? And if not, Malo, then go ahead if Dr. Wada doesn't come on.
Yes, non-medical issues. In Japan, there is no statistical data about the elder abuse was increased due to the COVID-19 pandemic. But domestic violence by the intimate partner or husband were increased during the pandemic.
And doctor, how are you treating those non-COVID medical issues that existed prior to COVID, mental health issues, these issues that are not being addressed because of the inability to get to physicians? Do you have anything? Has anything developed?
Yeah. As I said, as I said before, our medical association are assisting the social workers to cope with the difficult situations of older persons in this pandemic setting, especially in cases of neglect and elder abuse cases. And also, psychiatrists are assisting those social workers for their consultation.
Great, thank you. Mala, did you want to follow up on that?
I want to make a general comment related to this question raised by Salesh. I think what we need in our country to begin with, and not only in India, but in many of the Asian countries, is a very robust policy for older people, which takes into account their health needs, their social needs, their mental health conditions. Until we don't have an overall perspective providing specific services have their own limitations. So like our country is coming up with certain good initiatives to address concerns of older people. Few other Asian countries have come up. And I think in the next maybe 5 or 10 years, definitely there's going to be tremendous improvement. And I'm quite hopeful because a lot of experts are working on this issue. And yes, COVID did put certain things on the back seat, but again, it's picking up, and let's be more positive about it.
Thank you. We do have another question by Frances and Aiden, and she wonders, she muses how to overcome the fact that although there's a lot of awareness about violence and abuse against women and girls, older persons and older women individually, in particular, are constantly ignored. So how do we convince the women's movement that the older women need attention too? So within your else, perhaps in your country, how are things with regards to that? If you want to respond. If not, Elsie. Are women getting behind?
Susan, you were asking Elsie or me?
Both. Else first and then Elsie.